A very good evening to all of you doctors. Today we are going to do the important topic of endocrine system in medicine. The MCQs, relevant MCQs we will do one by one. So this medicine is very important as far as NEET PG is concerned. And in that also endocrine MCQs form a major chunk. Cardiology, endocrinology, these form the major chunk. Nowadays they are asking too many questions on endocrinology. So let's begin with the first question. Nuclear transcription factor PIT1 is now called as POU1F1, B POU1F2, C POU1F3, D POU1F4. What do you think is the correct answer here? Now, what does this POU stands for? POU stands for domain, POU domain, class 1, home box 1. PIT1 is a pituitary lineage determining factor. PIT1 is also known as POU1F1 is a nuclear transcription factor that plays a crucial role in development and function of pituitary gland. So the correct answer here is POU1F1. Peak ACTH secretion occurs at A 4 am, B 6 am, C 8 am, D 10 am. What do you think is the correct answer here? Peak ACTH secretion. Now, this ACTH secretion is pulsatile with circadian rhythm, peaking at 6 am and reaching another around midnight. Adrenocorticotropic hormone is secreted by anterior pituitary gland and plays a key role in regulating cortisol level from the adrenal cortex. The secretion of ACTH follows a diurnal or circadian rhythm with distinct peak and trough periods. Timing: ACTH secretion typically peaks in the early morning hours around 6 am to 8 am. This peak coincides with the highest levels of cortisol, which is a part of body's natural circadian rhythm. The peak in ACTH secretion is influenced by hypothalamic pituitary adrenal axis and is driven by circadian release of corticotropin releasing hormone from the hypothalamus. So factors influencing ACTH secretion are stress. Physical or emotional stress can lead to increased ACTH secretion regardless of the time of the day. So the correct answer here is B6. Bardet-Biedl syndrome is characterized by. Now, what is Bardet-Biedl syndrome? It is characterized by mental retardation, renal abnormality, obesity, hexodactyly, brachydactyly, or syndactyly. Now, Bardet-Biedl syndrome is genetically heterogeneous disorder characterized by retinal dystrophy, obesity, polydactyly, renal anomalies, and learning difficulties. The mutation in multiple genes, Bardet-Biedl syndrome is genetically heterogeneous. It can be caused by mutation in many of the several different genes. The genes involved, some of the most commonly involved genes in Bardet-Biedl syndrome are BBS1, BBS2, BBS4, BBS5, BBS6, BBS7, BBS9, and BBS10, and others. So the correct answer here is D, all of the above. Which of the following gene is associated with Prader-Willi syndrome? A. GnRH1, B. PROK2, CH7, SNRPN. This Prader-Willi syndrome, the chromosomal abnormality is deletion or uniparental disomy in chromosome 15. The gene involved is small nuclear ribonucleoprotein peptide N. Prader-Willi syndrome is a complex genetic disorder characterized by a variety of physical, behavioral, cognitive abnormalities. It results from the loss of function of specific genes on chromosome 15, typically involving a paternal deletion or maternal uniparental disomy. Both copies of chromosome 15 are inherited from the mother, that is maternally inherited. The features of this Bardet-Biedl syndrome are hypotonia. Newborn with this Prader-Willi syndrome often have poor muscle tone, leading to difficulties in feeding and delayed motor development. This can result in poor sucking reflex and failure to thrive in infancy. Then hyperphagia and obesity. Children with Prader-Willi syndrome develop an insatiable appetite leading to chronic overeating, which is known as hyperphagia, and severe obesity if the food intake is not controlled. The onset typically starts between ages 1 and 6. Growth hormone deficiency. Many individuals with Prader-Willi syndrome have low levels of growth hormone, leading to short stature and reduced muscle mass. Growth hormone therapy is often prescribed to improve growth and body composition. Cognitive impairment. Most individuals have mild to moderate intellectual disability. Motor skills, delay in gross and fine motor skills are common. So the correct answer here is D, SNRPN. Please click the link in the description box to join the ultimate Neet PG Breakthrough Blueprint event. This event will take you to the next level. It is an online event and the seats are limited. And the first 10 people who will click the link in the description box will get this masterclass absolutely free. This valuable masterclass will take you to the next level because all the 19 subjects will be revised in a holistic manner, including the multiple choice questions. Lymphocytic hypophysitis occurs mainly in A. Unmarried female, B. Postpartum female, short stature female, infertile female. In it, lymphocytic hypophysitis occurs mainly in postpartum women and presents with hyperprolactinemia and pituitary mass on MRI. It resolves after prolonged glucocorticoid treatment. So, lymphocytic hypophysitis is an autoimmune disorder characterized by inflammation of pituitary gland, often occurring in women during the late pregnancy or the postpartum period. The precise cause of lymphocytic hypophysitis is not entirely understood, but it is believed to be related to aberrant immune response. So the correct answer here is the postpartum period. Gene-associated unrich Lundborg disease is ACSTB, DEPDC5, EPM2A, LGI1. It is CSTB. Unrich Lundborg disease, also known as progressive myoclonus epilepsy type 1, is a genetic disorder characterized by myoclonus, involuntary muscle jerks, and tonic-clonic seizures. Here, the relevant chromosome abnormality is mutation of CSTB gene. The gene involved is cystatin B. Which of the following statement about Lennox-Gastaut syndrome is true? A. Multiple seizure type. B. EEG shows slow spike and wave discharge, impaired cognitive function. D. All of them. It is all of them. Triad of Lennox-Gastaut syndrome include multiple seizure type, slow spike and wave discharge on EEG, impaired cognitive function. Lennox-Gastaut syndrome is a complex, rare, and severe form of childhood onset epilepsy characterized by multiple types of seizures, intellectual disability. Characteristics of Landau-Kleffner syndrome include A. Auditory agnosia or word deafness, B. Normal hearing, C. Abnormal electrical brain activity, D. All of them. This is a childhood disorder in LKS, that is Landau-Kleffner syndrome. There occurs gradual or sudden loss of ability to understand and use spoken language. So the correct answer here is D. All of them. Gun barrel vision is best related to A. Anton syndrome, Balint syndrome, Claudius syndrome, Pallenberg syndrome. It is related to Anton syndrome. Cardacil is due to mutation in which gene? Notch 1, Notch 2, Notch 3, Notch 4. It is Notch 3 gene. Cardacil means cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. That is Cardacil. Pentobarb coma refers to coma due to accidental ingestion of barbiturate, coma due to barbiturate given for induction of anesthesia, high dose of barbiturate for refractory elevated ICPD, any of the above. It is C. Polycystic lipomembranous osteodysplasia with sclerosing leukoencephalopathy is also called A. Nasu-Hakola disease, Moto-Hashi Shinohara disease, Akai Takahashi disease, Nakamogi-Shioya disease. It is Nasu-Hakola disease. Which of the following procedure is used for correction of TGM? Mustard procedure, sending procedure, Rastelli procedure, D. All of them. It is all of them. Tarenflurbil and semaglutide are A. Estrogen analog, B. Vaccine, gamma secretase inhibitor, HMG corektase inhibitor. It is gamma secretase inhibitor. Dementia pugilistica is related to which of the following? Non-convulsive seizure disease, recurrent head trauma, and potential professional boxers. D is the correct answer. Familial Parkinson disease is a mutation in which of the following genes? PINK1, DJ1, Parkin, all of the above. It is all of the above. Familial Parkinson disease. Which of the following about Kupffer-Rakeb syndrome is false? So the false statement is B. None of the above. The only oral agent that reduces dyskinesia while improving Parkinson is S-allegilin, B. amantadine, C. bromocriptine. It is amantadine. Swollen axon of Purkinje cells are called as torpedoes. Which of the following is a gene for isolated dystonia? TOR1A, TOP1, ANO3, all of the above. It is ANO, all of them.